Excuse me, Dr. Langdon? Almost all of our labs are back on Sleeping Boy Tyler. All 100% normal. What are we missing?
Is he waking up?
No, he's still fast asleep.
Most of the lab results are in.
Let me call the lab. Maybe the toxicant is back. Hey, this is Dr. Langdon from the ED. No routine cases until we assess the tier 1. Thanks.
Dr. Langdon?
So, how's the VA?
Yeah, it was good. Challenging. I learned a ton. I just think maybe it should be mandatory that all doctors spend time there, like on a regular basis, because of all they've sacrificed for us.
That's a nice thought. How'd you choose the Pitt?
Oh, I have a sister with special needs, and she got into this really great facility here in Pittsburgh. And PTMC has such a great reputation. I thought, it'd be a good.
Can I present my headache to you?
Yeah. What do you got?
A 36-year-old woman with severe headache due to paracervical trigger point. Her pain went from 11 to 0 after 2 cc's of IM Marcaine.
Wait. You did a trigger point injection before presenting the case?
Yeah.
Interns always present first.
I spent a month at the pain clinic.
No, it's not okay.
I'm very comfortable.
One. Back in my throat.
That's probably from the nosebleed.
Tacky at 120, pulse ox borderline at 90.
I've never done a crike before.
No, Mel will do the crike. You've already had a busy morning. Glove up, Mel.
No, I'm doing the crike, doctor.
You would be doing it, doctor, if it wasn't an odd day. Surgery gets even days, ED gets odd days. You know this. For Crike's sake.
It's because you're all fucking odd down here.
Seconds you could use a 10-blade, your finger in a bougie.
This is called a Wheatlander.
Hey, next. Get ready to bag the crike.
Does your resident know how to suture, or do I need to teach?
You're all class, Yo-Yo.
I know. Thanks. That means a lot of nothing coming from you.
Mel, you okay?
If you're done fighting.
We're not fighting. This is playing. Langdon's too soft to fight.
Oh, yeah. I have nothing but respect for Dr. Garcia. In fact, I think she would make a wonderful hostess at Applebee's.
Later, odds.
Sorry.
You're doing great. Take your time. You okay?
I get frustrated when I can't do things, or at least it looks like it.
Yeah, you and me both.
Thanks, but my frustration manifests itself emotionally, and then I get upset, and then it looks like I can't handle things, and then I can't cry in front of the patient because no one wants to see their doctor cry. That's just a big red flag.
You just did a perfect crike. You're doing great.
Because your son tested positive for THC, the psychoactive ingredient in cannabis, we're gonna have to admit him for overnight observation and monitoring.
What about his brain? Is there a chance that much pot is going to do some damage? I mean, he's only 4.
The honest answer is we don't know. There haven't been any long-term studies, but the fact that this is a one-time occurrence suggests that there should be no long-term effects.
But you don't know. So my son could end up with learning disabilities, psychiatric problems, or even autism because
there's no evidence to suggest any of that.
Hello, I'm Kiara Alfaro. I'm the department's social worker.
True.
Get security. If you can't cooperate, I'm gonna have to ask you to leave.
Amanda, please, he needs to stay here.
And you need to get a...
I think this guy's got scurvy.
Was he a pirate?
No, he's an unhoused man. Lives almost exclusively on dollar store ramen. There's parafollicular hemorrhage, gingivitis, bleeding gums, and no fruit or vegetables in his diet.
I suppose that could do it as long as you've ruled out piracy. No parrot, no peg leg, doesn't reek of sweat and rum.
Well, now that you mention it, there was a smell.
Probably a pirate. Tell him to pick up some vitamin C next time he docks at a dollar store.
I can't tell if you're joking.
No, Captain Scurvy's got a vitamin C deficiency. Cheapest way to fix it is with a daily supplement.
Captain Scurvy's another joke.
I'd like to think so.
It's a good one.
Dr. Langdon, Dr. King, this is Arthur Carlson from Children, Youth, and Families. He'd like to speak to the parents of Tyler Jones.
Right. Mel, would you mind showing him to Kiara and the family?
Yeah, right this way.
How are they making out?
They're still talking.
You okay?
Yeah, for sure. I just hate seeing families torn apart.
Oh, they'll be fine.
How can you be sure?
They're white. Probably get off with a slap on the wrist. If they weren't, she'd probably lose her child and he'd end up going to jail. But... Sorry, I did a fellowship in cynicism. You sure you okay?
100%. I'm just gonna get some air.
Stim me with me, Mel.
Right behind you.
Dana, what's open?
Trauma 2.
All right, keep it that way. Our target door-to-balloon time for STEMIs is 51 minutes.
Ambitious.
But doable.
As you're about to find out.
Mr. Ed Gellin is 52 years young with a history of hypertension and hyperlipidemia, 20 minutes of substernal chest pain, 10 out of 10 with dyspnea and diaphoresis. BP is 152 over 95, currently chewing 324 mgs of baby aspirin.
Okay. Mel, what's the safe window for cardioversion?
12 hours.
What happens after that?
Increased risk of embolic stroke from left atrial blood clot.
Go get him, Tiger.
Moving in there! Ma'am, hold still. I can't help you if you keep moving your head. Get it fucking out! I can feel it.
Arthropod in the EAC. Bad news first.
What's the good news?
Ear canal is numb. Simple flush with saline will fix the problem.
What's the bad news?
You've got a dead bug in your ear. Cockroach.
I noticed that you and Langdon have really been hitting it off.
Think?
Yeah. Have you noticed anything strange about his behavior?
Like what?
Anything at all?
I have noticed that he has a tendency to sweat a lot. I don't know if that's weird. It could be genetic.
Yeah, but just keep an eye out for me.
Okay. Is everything okay, Dr. Langdon?
Oh, yeah. I got Dr. Google in Central 9 bombarding me with questions like my 4-year-old. I couldn't even get through a history.
Is that his chart?
Yep.
Can I see it?
Knock yourself out.
Oh, he's autistic. Did you see that in his past medical history?
It's an ankle sprain. It has nothing to do with the injury.
I could talk to him.
Great. I can see 3 other patients while you do.
Have you seen our... Let's get you to that tournament then. So, Terrence, would you walk around the room for me, please? I'll be able to tell a lot more about your injury.
Hurts a little.
How painful? On a scale from 1 to 10, 10's the worst.
The worst? The worst I've ever felt or the worst that a human being can experience?
A little pain is a great answer, Terrence. Thank you. Well, based on your walking around, I don't think it's a serious injury. You know what? There's actually something I want to show you. I'll be right back. Sometimes this tendon called peroneus brevis can pull off a piece of this bone, the 5th metatarsal.
That's the dancer's fracture, right?
Exactly. You most likely have a 2nd-degree ankle sprain. The x-ray will tell us everything. Tech will come get you, and then I'll come back and show you the images.
Great.
Okay. I'll put the orders in.
How'd you do that?
Do what?
Talk to him.
I listened?
Funny. No, you unlocked something. I wasn't getting anywhere with them.
Oh, my sister is on the spectrum, and the ER can be a very, very overwhelming place for autistic people. So I don't know, it just takes a different approach.
You and your sister close?
Yeah, we're best friends. There's this one time we were on the swing,
I gotta hit the head.
and then
Let me know when the x-rays are back.
Huh?
To stop the swelling, ice for 20 minutes twice a day and wear the ankle strap until the pain is gone and for another 6 weeks whenever doing anything athletic. Any questions?
No, I'm all set.
And sorry we got off on the wrong foot. That was a joke.
I understood your intention. Is Dr. King around?
She might be with another patient.
Will you tell her goodbye for me? She's a very good doctor.
Right. Sure, yeah. And good luck with your table tennis tournament.
Thank you. If you ever find yourself in South Park, I'll teach you how to play.
Okay. Your ankle guy was looking for you.
Oh, sorry I missed Terrence.
You were great with him.
I know what to say, I guess. Maybe how to say it.
Because of your sister?
Yeah. I know she's in a good place. I really miss her.
Well, you're obviously really good at helping people. You're crushing it with your patients. You even taught me a couple things.
Really?
For sure. You're making a great first impression. Can you just put him on the phone for a second? I just want to hear his voice. There's my guy. How you doing, buddy? I would love to hear your song. How we doing in here?
You should write that bitch a script for calcium, because I didn't even hit her that hard. Too much almond milk in your soy lattes!
You know, most commercial almond and soy milks are fortified with calcium, so they end up having a higher percentage of calcium than cow's milk. Prepped with betadine and drinks.
Very nice. Let's have a closer look. Dr. King, can you please grab me a 10cc syringe, a 20-gauge needle, and some sterile saline?
Fuck it out, stitch me up, and send me home. I've got to get back out there to my kid.
Well-
He's still waiting to be seen, by the way.
Afraid it's a little more complicated than that. You got yourself a fight bite, which means a couple things. First, we need to determine if the bite extended into the joint space. If it did, you're going to need IV antibiotics and a trip to the OR to see a hand surgeon. Pinprick and a little burning.
An operation?
Well, you're just shouting a minute ago about infection. And with good reason. While I am sure you are in the clear for rabies and HIV, human mouths are filthy, some more than others.
How can you tell if it's bad?
Great question, Dr. King.
I'm sorry?
I am going to inject some sterile saline into your knuckle joint, which you won't feel because of the anesthetic. If it comes spraying back out of the bite wound, we'll know. Ready?
I guess.
There she blows.
Shit. Are you serious? You hear that, you fucking bitch? I've got to have surgery thanks to you. Good. You assaulted me. Damn right. And I'll bet next time you'll keep your masks and opinions to yourself.
You okay?
Yes.
3 grams Unison IV. Call the OR. Tell them we have a fight bite that needs to be washed out. Then go take 20 minutes in the lounge. I'll come find you if I need you.
Well, I don't need a break.
Yes, you do. Okay. This must be Crosby. Heard a lot about you, buddy. That was my least problematic trainee. Well, technically, you're all pretty green, but you're growing on me.
Thank you.
So, how you doing?
Good. Yeah. Better.
Yeah?
It's just, it's the little girl and the sister's just too close to home.
The things we do are hard.
Yeah.
You're, sitting here feeling like maybe you're not up to it.
Yeah.
Been there. We all been there. Mel, you're a sensitive person. This is a tough place for sensitive people, but we need them badly. Now, if you're ready, I need you. It's a perfect job. It's practically a Zen exercise. I've got 1,000 pieces of gravel that need to be plucked out of a 2-foot-long road rash.
1,000?
Yeah, give or take 100. South 20. Make sure you close the door behind you. Don't want Crosby getting out.
Yeah. No, thank you. No problem. I'll be right there. That's a lot of gravel.
Mr. Purnell, you are in luck. If I had to have gravel meticulously picked out of my leg, this is the person I'd call. Dr. Mel King, detail specialist.
Hello.
I love your dog.
Crosby, how is he?
Oh, he's great.
Here, something helps see up close.
Hey, I don't want to be one of those people who say they need an emotional support animal, but is it possible he could be with me? We could tie his leash to the bed. He wouldn't be in any trouble, I swear.
What do you think?
I'm happy to go get him.
Any pain here?
No?
Okay. You go get the dog. You get to work. I am going to get some more gauze from triage. And just in case, if anybody asks, just say you need him for anxiety.
Okay. Thanks.
Have you seen Dr. Langdon?
He left for the day.
Didn't say goodbye. I really wanted to tell him about this delivery. It was really cool. I mean, the dads were so happy. And,
Great stuff. Dr. Robbie?
I need 0 form, cut 4x4s, and elastoplast tape.
You're here.
In the flesh. What do you got?
Otto versus Ped.
We thought it was just a tib-fib fracture.
Then we found an occult liver laceration.
Leg is low priority right now. If she stabilizes with blood, she can wait an hour for the OR.
And if not?
Front of the line, baby.
Your son's in the OR with the GSW of the chest.
Sweet. Family reunion and post-op.
Whitaker, I'll be right back once this unit's in.
Hey! Good catch, you two.
Hey, Langdon, we're out of 0 form. I'll try to find some.
That's 1 unit in. Her pulse is stronger, but she needs more blood.
Not today. Only 1 unit if the pulse picks up. We're already rationing our blood supply.
What if we run out?
Who wanted rainy clips?
Oh, me. Thank you. Do you feel anything, Grayson?
No pain. Just a lot of sadness for the world we live in.
I hear you.
Any room in the inn?
What's her story?
This is Dawn. No trauma. Insulin reaction. Responded to D50.
D10 out of 100 an hour?
Perfect. Oh, and I borrowed your butterflies on the gurney.
So just like that. Yep.
What are you doing?
Treating a patient?
Rainy clips. Clamping off a bunch of subcube leaders.
Good work. Keep it up.